medicine, we encounter the end-stage consequences of disease constantly, and diabetes, or more precisely, what prolonged high blood sugar does to the human body over time, is one of the most recurring themes across all of it. Foot amputations, kidney failure, vision loss, heart attacks, strokes, these aren't textbook rarities for us. They fill entire hospital wards, and almost without exception, they develop gradually and silently over many years. Years during which blood sugar was running too high, nobody stepped in meaningfully, and the damage was quietly building beneath the surface. So when research emerges showing that a simple, everyday habit can genuinely move the needle on this problem, I think it deserves far more attention than it typically receives. This study was conducted by Dempsey and colleagues and published in Diabetes Care in 2013. It involved 9 older adults who were all heading toward a type 2 diabetes diagnosis. They took part in 3 separate experiments on different days, and what they found is something most people genuinely wouldn't anticipate. On day 1, they simply sat for 3 hours with breakfast and lunch in between, a perfectly ordinary day for most of us. On day 2, they completed a 45-minute walk before sitting down for 3 hours exercise first, then prolonged sitting. On day 3, they sat for 3 hours, but every 20 minutes they stood up and took a 10-minute light walk, repeatedly breaking up the sitting throughout the day. Blood sugar was tracked continuously across all 3 experiments. Here's where it becomes genuinely fascinating. The 45-minute walk, the dedicated exercise session, helped marginally, but it didn't meaningfully reduce the blood sugar spikes that followed meals. Even after exercising that morning, blood sugar still climbed sharply after eating. The broken-up walking, however, just 10 minutes of gentle movement every 20 minutes reduced post-meal blood sugar spikes by around 30% compared to uninterrupted sitting, not 5%, not a modest improvement, 30% from light walking distributed across the day. That is a remarkable finding, and to understand why it happens, we need to walk through how blood sugar actually works, because most people have genuinely never had this explained clearly. When you eat, sugar from that food enters your bloodstream, blood sugar rises, and your body needs to move that sugar out of circulation and into your cells, where it can be converted into energy. To accomplish that, it releases a hormone called insulin. Think of insulin as a key and your cells as locked doors. Insulin unlocks those doors and allows sugar to enter. This is a normal, healthy process happening inside all of us continuously. Your muscles are by far the largest storage site for blood sugar. They absorb the majority of what enters your bloodstream after a meal, but here is the part that changes everything. Your muscles have a second mechanism for pulling sugar out of the blood, one that operates completely independently of insulin. No key, no lock. This second pathway activates simply through muscle movement, through contraction, through muscles doing exactly what they were built to do. When you walk, even gently, your muscles contract and begin drawing sugar directly out of your bloodstream on their own. It's as though a second door opens and sugar flows straight in. Now consider what happens during hours of uninterrupted sitting, which most of us do daily because modern life and modern work essentially demand it. Your muscles are doing almost nothing. That second mechanism is effectively switched off. When blood sugar rises after a meal, the insulin system has to manage it alone, and in people whose insulin system is already beginning to struggle, which is far more common and far more frequently undiagnosed than most people realize, blood sugar stays elevated longer, spikes higher, and the repeated physiological stress of that cycle, meal after meal, year after year, is precisely what drives the body toward prediabetes, then type 2 diabetes, and ultimately the complications we see filling those hospital wards. But when you stand up and walk, even briefly, even slowly, that second mechanism switches back on. Your muscles begin contributing. Blood sugar has somewhere to go. The spike is smaller, the recovery faster. That is exactly why distributing movement throughout the day outperforms a single morning exercise session for blood sugar control. And this directly challenges the way most people think about exercise. Many treat it as something confined to a specific window, the gym before work, a run in the evening, and then spend the remaining hours sitting, operating under the assumption that the morning session has covered everything, that it provides protection for the whole day. This research suggests it doesn't. Not entirely. The consequences of sitting for 8 to 10 hours are at least partially distinct from whether you exercise that morning. These are 2 separate problems. Regular structured exercise remains critically important, but it doesn't neutralize what prolonged sitting does to your blood sugar throughout the day. You need both. So what do you actually do with this? What I tell my patients is that the single most impactful thing you can do is walk after meals or do anything after eating that isn't sitting down even for just 5 to 10 minutes. This is where the evidence is clearest and most immediately actionable. We know blood sugar begins rising within roughly 15 to 30 minutes of eating. If you move during that window, your muscles activate and begin pulling sugar out of circulation directly, and the spike is meaningfully reduced. Research shows that even 2 to 3 minutes of walking after a meal produces a measurable effect. You don't need distance, you don't need speed, you just need movement. Walking up and down stairs a few times qualifies entirely. If you work at a desk, set a timer every 60 minutes or every 30 if you can manage it, and get up, get some water, walk around the room, step outside briefly, because none of this is about fitness or burning calories. It's about keeping that second blood sugar mechanism active throughout the day rather than allowing it to go dormant for hours at a stretch. If you wear a smartwatch that nudges you to stand up, actually do it. It's pointing at a genuine biological need, not vague wellness advice. This matters most, obviously, if you have type 2 diabetes or have been told you're at risk, but blood sugar regulation is relevant to every single one of us. Chronically elevated blood sugar, even at levels that don't formally qualify as diabetes, is associated with meaningfully higher risk of heart disease, stroke, cognitive decline, and kidney damage over time. You don't need a diagnosis for this to matter. A 30% reduction in blood sugar spikes from a 10-minute walk, requiring no equipment, no gym membership, no prescription, just well-timed movement distributed through the day, is significant. It's also remarkably easy to incorporate. A lot of people hear this and say it doesn't feel like it should work. It's just a bit of walking. And I understand the skepticism, but the evidence is clear. If you care about your metabolic health, your glucose response, your long-term disease risk, then this is one of the most accessible and effective changes available to you. 10 minutes of walking after meals or every 30 to 60 minutes at your desk is genuinely one of the most powerful things you can do for your health, and almost anyone can do it, starting today. So IBS is really common. Bowel cancer is also quite common, and the symptoms overlap. And that right there is honestly one of the most confusing things for people to get their head around when something doesn't feel right with their stomach or their bowels. Now, every single shift that I work pasted rewrite this script and don't change length 2051. Here's the rewritten script. IBS is extremely common. Bowel cancer is also fairly common, and the fact that their symptoms overlap is honestly one of the most disorienting things people face when something feels off with their stomach or their bowels. Every single shift I work in the emergency department, I'm seeing people with abdominal pain, every shift without exception. It probably accounts for around a quarter of everything I see in some form or another, and a lot of those people are understandably frightened that something serious is going on, frightened that it might be cancer. So what I want to do today is give you a genuinely clear framework for understanding the difference, what doctors are actually looking for, and when you need to take action. I also want to address something that catches a lot of people completely off guard, a psychological trap that can cause people who already have IBS to miss something that genuinely matters. I'll come back to that. But first, let me be very clear about something. Most people with bowel symptoms do not have cancer. The overwhelming majority of the time, there's a completely benign explanation. Bowel symptoms are among the most common things any doctor encounters, but there are specific patterns, specific combinations, specific ages, and specific changes that doctors are trained to recognize as warning signs. By the end of this video, you'll know exactly what those are. Let's start with IBS. Irritable bowel syndrome is what we call a functional bowel disorder. That means there's no structural damage. Nothing is physically wrong with the bowel itself. If you looked inside with a camera, a colonoscopy, it would appear entirely normal. The bowel is functioning. It's just functioning poorly. There's no inflammation, no cancer, no tissue damage, just a bowel that's become somewhat dysregulated in how it operates. IBS isn't diagnosed by finding something abnormal on a scan or blood test. It's diagnosed based on the pattern of symptoms. That's an important distinction because it means it's what we call a clinical diagnosis. Your doctor is listening to what you describe and recognizing a familiar pattern. What does that pattern look like? Typically, it's recurrent abdominal pain that keeps returning, often crampy, often in the lower abdomen, and crucially connected to going to the toilet. Either it builds when you need to go, or it eases when you do. Sometimes both. There's often a change in stool frequency or consistency, going more often, going less, looser. Stools or spells of constipation. Bloating is also very common, that uncomfortable fullness and abdominal distension that accumulates through the day and tends to ease overnight. Mucus in the stool is something many people notice and understandably worry about, but it's actually far more commonly associated with IBS than with anything sinister. In isolation, it's generally quite reassuring. Critically, IBS is something that's typically been present for months, not something that appeared a few weeks ago. It's a long-standing, chronic, fluctuating condition. It waxes and wanes. Better periods, worse periods. Stress tends to aggravate it. Certain foods make it worse: onions, garlic, beans, wheat, though everyone is different. Anxiety frequently makes it worse too, and it typically begins under the age of 50, often in younger adults, sometimes as early as the late teens or early 20s. In my own view, one significant reason bowel problems are becoming more prevalent in younger people is ultra-processed food. I think in a few decades we'll look back at this era and recognize the specific damage it has done to gut health. Ultra-processed foods aren't made of things the gut recognizes as food. They're loaded with emulsifiers, preservatives, gums, fillers, stabilizers, and chemical combinations that the human gut has simply never encountered across its entire evolutionary history. The gut doesn't know what to do with them. The microbiome, the bowel lining, gut motility, the entire functional ecosystem of the digestive system is disrupted by these substances. That, in my view, is a meaningful driver of what we're seeing. So if you have IBS or suspect you might, taking an honest look at how much ultra-processed food you're consuming is a very reasonable starting point. Now, with IBS broadly covered, let's talk about bowel cancer and specifically how it tends to present differently, because this is really the heart of it. It's not that these two conditions share no symptoms, they do, but the pattern is strikingly different, and the pattern is everything. Bowel cancer tends to present with symptoms that are progressive rather than fluctuating. That word progressive is the critical one. IBS goes up and down, good days and bad days, good weeks and bad weeks. Bowel cancer, by contrast, tends to persist, symptoms that are consistently present, that accumulate, that worsen over time rather than coming and going. Under NICE guidance, that's the National Institute for Health and Care Excellence in the UK, the red flags that GPs are specifically trained to act on are the following. Rectal bleeding, particularly in anyone over 50, is a red flag requiring attention. A change in bowel habit lasting more than 3 weeks, especially toward looser stools or increased frequency, is a red flag. Unexplained weight loss, losing weight without trying, without an obvious reason. Perhaps noticing your clothes fitting differently is a red flag. Iron deficiency anemia, often picked up incidentally on a blood test and presenting as fatigue or breathlessness, can result from slow, unnoticed bleeding from a bowel tumor. Persistent abdominal pain combined with weight loss is another. And a significant family history, a first-degree relative, a parent or sibling, who has had bowel cancer is something that should prompt urgent investigation. Let me lay this out side by side because I think this is the most practically useful part. With IBS, symptoms come and go, they fluctuate, they've typically been present for months or years, the pain is often connected to the toilet and relieved by it, there's no unexplained weight loss, no anemia, it's frequently tied to stress, or particular foods, and it typically begins in younger people under the age of 50. With bowel cancer, the change tends to be relatively recent, something that wasn't present a few weeks ago or a noticeable departure from that person's normal. Symptoms persist and progress. They don't really ease or improve, if anything, they worsen. There may be blood mixed in with stool or visible on tissue. There may be unexplained weight loss or fatigue from anemia, and here is one that's particularly worth highlighting as a red flag: symptoms that wake you from sleep. IBS does not generally disturb sleep. If you're being woken by abdominal pain, by an urgent need to use the toilet in the night, or if you're waking drenched in sweat, book a doctor's appointment without delay. Age, as I've mentioned, is genuinely important here. The risk of bowel cancer rises substantially with age, and the threshold NICE uses is 50. If you're under 40, with long-standing symptoms that fluctuate, that are clearly linked to food or stress, with no blood, no weight loss, no anemia, and a pattern that's been consistent For months or years that clinical picture points strongly toward IBS. That doesn't mean you don't deserve to see a GP, absolutely it doesn't, but the probability strongly favors a functional rather than a sinister cause. If you're over 50 and you've had a new change in bowel habit persisting for several weeks, or there's bleeding, or there's weight loss that needs to be investigated, book a GP appointment today. The 2-week wait pathway in the UK exists precisely for this situation. To be balanced about it, yes, younger people can develop bowel cancer. I've known someone quite young who died from it relatively recently. It's not impossible, and rates in younger adults have been rising in recent years, but the probability remains significantly lower, and the pattern of symptoms matters even more in that context. Red flags are red flags regardless of age. Blood in the stool is always worth investigating. Unexplained weight loss is always worth investigating. If you're concerned if you have any of the red flags I've described, or even if you have none of them and you're simply worried, please see your doctor. That is what we are here for. It's also worth knowing that if you're between 50 and 74 in the UK, the NHS will automatically send you a home fit test as part of the National Bowel Cancer Screening Programme. It arrives in the post, you sit, it costs you nothing. It exists because catching this early makes an enormous difference to outcomes. Now that psychological trap I mentioned at the beginning, if you've had IBS for years, which many people have, there's a strong tendency to attribute every new bowel symptom to your IBS. Something shifts and your immediate thought is, it's just my IBS again, and I understand that completely. For years, every gut symptom has come back to IBS. It's a logical, rational assumption to make, but I want you to be genuinely aware of this, because it leads some people to dismiss symptoms that genuinely need attention. If you have IBS and something feels different from your usual pattern, not just a bad day, not just a typical flare, but something that genuinely doesn't fit how your IBS normally behaves, that is when you need a medical review. Call your GP and say, I have IBS, but I've developed some new symptoms I'd like to discuss in medicine. Your baseline matters enormously. You know your gut. If it's behaving differently from how it normally does even during a bad spell, that difference is worth raising with a doctor.